Hello, I'm Greg Jamian, and welcome to Home Health Care Corner. As more people receive their medical services and care at home, there are many questions that pop up that sometimes require quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hi, my name is Janet. I'm a registered nurse at Ameristaff Nursing Services, and I'm here today with Erin, and we're going to talk about the difference between anticoagulants and antiplatelets. Hi, Erin.
Hi, Janet.
Hi.
So these are both blood thinners.
They're both a type of blood thinner. That's why they get kind of confused. The anticoagulants are more so the blood thinners. They keep your blood from sticking together and thin, and so that's why they're kind of called that. Type of blood thinner or anticoagulants is like heparin. They give that to people in the hospital if you've had a heart attack or a stroke, blood clot in your leg, you have valve problems. Heparin is usually only given into the hospital because it's very short acting, doesn't last in your blood for very long. So they can give you that heparin shot in your belly. It's an injection also, and that's why people sometimes come home with bruises on their bellies and their arms, and that's to prevent a blood clot from when you're in the hospital. But when you go home from the hospital, you need to continue that therapy, especially if you're prone to clots, like clots going into your heart or your lungs. So they would prescribe something for you to take at home. One of those things that a lot of times the most common thing everyone hears out there is Coumadin or warfarin, and that is because it's been around for a long time. It's very cheap. It's been on the market for a long time, and it's very effective, but some of the problems with taking Coumadin is you always have to watch your diet. You can't have a diet rich in vitamin K because vitamin K will negate what Coumadin does. So it kind of is like that eraser, and it erases the effect. So if you have too many vitamin K, things like dark green leafy vegetables and broccoli, there's even some vitamin K. Anything with dark green, the green has the K in it, and so then like kale, spinach, that will erase the effects of Coumadin. So you also have to monitor that to make sure with the blood test that you're getting in the proper level. The proper level of Coumadin is between 2 or 3. If it's below 2, it's not working, it's not giving you the effect, so you could have a clot, or if it's above 3, you could bleed. Some of these medications, if you're on too much of them, the side effect is bleeding. So the blood comes too thin and you have a nosebleed that can't stop bleeding, or you have bleeding in your stomach that usually is like you vomit blood up, which could be dark coffee ground emesis. You could have bleeding in your urine or in your stool. That's one way you can see it. So those are the things you got to look for. Or if you cut your finger and it won't stop bleeding, then maybe your blood thinner is too much, like you're on too much of it. So you would go to the doctor, they would check your blood, or you'd have a nurse come in to check your blood in the home. They also nowadays have monitoring kits that you can get over like the internet and monitor yourself at home. So,
but you really have to be diligent, it sounds like.
That's the problem with Coumadin, because you have to be on it. You can't, you have to be monitored very closely with that medicine. So they've come up with other ones. The very popular one now is called Lovenox, but that's an injection too. So you don't have to watch your diet with that one. You don't have to monitor it as closely, but it's expensive, and you have to be able to give yourself an injection. A lot of people don't want to do that. It's kind of hard to do that.
Now, is it the same type in your stomach, or is it in your arm, the injection?
It's both. It can be in your leg, it can be in your belly, it can be in your arm. So, I mean, you can do it yourself, but it's, you know, it's kind of hard sometimes. So
I'm sure.
that's a drawback of it. One of the newer ones that they've come out with is called Xarelto, or Eliquis is another one, and that's coming to fame because it's an oral medication that you can take that doesn't have to be monitored as closely as Coumadin. It hasn't been on the market too much longer, but too long, so they are still studying it, but it seems to be having some great effects. The drawback of that is the cost right now because it's new to the market, so there's no generics, so the cost is a little bit expensive, but if your insurance covers it, it's a good thing to look into too. The next subject is an antiplatelet. An antiplatelet means it prevents the blood from sticking together, so it prevents you from forming the clot in the beginning. So that would be things like aspirin. So you hear that when you are having a heart attack or you think you're having a heart attack to chew an aspirin. They say that that's a good thing, and that's because it's hopefully preventing the blood from clotting together, so you're not, you know, prevents the clot from forming in your heart to make the heart attack.
Now, can I just ask one question?
Yeah.
When they say take an aspirin when you're experiencing a heart attack and chew it, what's the difference between chewing it and just swallowing it?
Because chewing will get into your bloodstream faster.
Okay.
Because it will get into your oral membranes are very rich, and it will go in faster. That's like when you're having a heart attack, that's why they put the nitro under your tongue too, because it absorbs it into your system much faster than going through your whole GI tract and then the medicine kind of working from there. It gets it into your bloodstream a lot faster.
Okay.
Another antiplatelet medicine that they put people on is Plavix. A lot of times they'll put long-term time people on that to prevent something in the future. You can take aspirin and Plavix together, and you can also take Coumadin and Plavix together. Sometimes they thought at first you couldn't, but you can because it works on different ways. Again, you just have to monitor your blood work and stuff like that. The other one is Ticlid, is another antiplatelet that you hear a lot. There's no real side effects. You don't really have to monitor anything when you're on the Plavix or the Ticlid, so that's a good thing. It's more of preventing it in the future. So if you're prone or you have a history of high blood pressure, history of strokes or heart failure, anything like that, sometimes they'll put you on that to prevent it in the first place. Where the anticoagulants like Coumadin, that's more to when you're having the blood clot to break it up, so you doesn't have any lasting effects like a stroke or a heart attack. So. If you have any further questions about your anticoagulants or antiplatelets, please call Ameristaff at 248-288-2270 or speak to your physician.